Healthcare professionals experience occupational health and safety problems virtually every day. From trip hazards to chemical spills to workplace violence, frontline nurses come across problems in their workplaces that can significantly impact on their ability to perform their duties safely. Occupational health and safety hazards can put patients, residents, and clients at risk. Consider the statistics. In 2013 alone, thousands of healthcare workers were injured, some of them critically, on the job. There were 639 accepted Workplace Safety and Insurance Board lost time claims for violence, 2,729 claims for musculoskeletal disorders, and 1,208 claims for falls. To put it simply, nursing is dangerous work. But what if a worker who comes across a health and safety hazard takes action that improves the workplace? 3 Ontario Nurses Association members were faced with safety issues and took the initiative to correct their situations that benefited not only themselves, but their patients, colleagues, and others. While performing her duties as a registered nurse, Elizabeth Hart contracted scabies from a patient. She was determined to ensure that her colleagues didn't go through what she had to endure.
We had a big problem with our isolation gowns. Was a huge hazard because we were just using a really thin paper, cheesy isolation gown, and all the staff ended up in the entire intensive care unit contracting scabies. So quite a number of us, and unfortunately a lot of the family members were affected with this as well. Through lots of legwork, research, contacting the CEO, I was able to get new gowns hospital-wide. It's made a huge impact, and we're looking at our rates of transmission of other diseases are well decreased as well since we've had the new isolation gowns. Always report the hazard. Don't feel like you're going to be penalized for reporting it. We're there to help each other, and we need to work as a team. Work together, and then we can be healthy together.
ONA member Danielle Latulippe-Larmande supports workers in a busy mental health facility. Unfortunately, violence and abuse are very common, and she does not always get the much-needed support from her employer.
My workplace can be very unsettled, and it can be very violent. The majority of our workplace issues here are around violence. My experience with health and safety and management's view of it is totally different. Especially where I work, it is absolutely seen as normal to be verbally abused, to be hit. So if you're bruised, you really didn't get hurt. It was just a small hit. So we have a very different view of what's acceptable and what is not acceptable. And I've made it very clear that none of it's acceptable. There is nothing with regards to mental illness that says you're more violent or that it's okay to be racist. It's not a symptom of mental illness, and it's not acceptable. So you need to report if you want a safe work environment.
Some of the major occupational health and safety hazards that our members face in all of our workplaces are workplace violence, unsafe staffing levels, infectious disease, exposure to chemicals, anti-neoplastic drugs, bleach, exposure to mold, exposure to asbestos, slips, trips, falls, hazards, needle stick injuries. And one of the big issues is just employers not addressing health and safety concerns.
Judy Evans, a nurse for over 45 years, explains how ONA helped her better her own workplace conditions.
I started doing these inspections and saw the conditions that nurses had to work in. I really just found it difficult to see that we've taken the caring profession and not cared for the caregivers. The nurses in the hospital, for a variety of reasons, had no place to clean bedpans in the patient rooms. So what they were doing was emptying the bedpan, and it didn't matter what the body fluid was, so it included vomit, blood, everything. They would empty the bedpan or the basin in the toilet, and then they would have to use the one sink that's in the room to wash them out. and that same sink would be used for bathing patients and for staff and everybody else to wash their hands in, because it was only the one sink. So when we brought it forward through our Joint Health and Safety Committee, there was a lot of pushback from the employer, and I really felt intimidated by the hospital. They did a lot of kind of ganging up on me, and there wasn't a lot of support for the staff, particularly if you're a bedside nurse. And ONA got very actively involved, and they started writing letters, and we were having meetings with HR. We had meetings with the Minister of Labour, and they were quoting all the different areas to force the hospital to do what was appropriate based on the Health and Safety Act. Without the help of ONA, I doubt we'd have got anywhere, and the place would still be doing bad practice. The best thing that a nurse can do to help make her workplace safer is to not be afraid of the hospital, realize that they do have some protection, to try to bring it into the Health and Safety Committee if that's at all possible. And if they're still getting pushback, or if they find that they're having trouble in their actual job, that they probably have to get ONA involved to come to the rescue.
The Ontario Nurses Association does not take occupational health and safety hazards lightly. As one of Canada's largest unions, ONA takes a strong leadership role in fighting for the rights of all workers so that they can work in a healthy and safe environment. Workers must report all hazards, whether small or large, to their manager.
If you're seeing a hazard, you need to report. If there's an injury, you need to report. The issues that are taking place for you are also impacting other workers that you are with each and every day. Nurses are great advocates for patients. We need to also be advocates for ourselves. And taking those issues forward, knowing that we have probably one of the strongest pieces of legislation to help us along, and that's the Occupational Health and Safety Act. Your employers, even though there might be some hesitation at first, they understand the risks and they understand their obligations as an employer. And I can assure you that if you take those forward, they know that they have an obligation to work with you, and they will work with you. And at the end of the day, it's going to be better for their workplace and our workplace. The great thing about being in ONA is we aren't alone in this. There's 60,000 plus members, strong, united, professionals caring for patients that are going to be there walking beside you as you take these issues forward for resolution.
You can take actions to make your workplace safer. Report all hazards, injuries, and illnesses. By doing so, you meet your legal obligations and place those obligations on your employer and supervisor to take action to ensure the issues are addressed. Report to your manager and employer. This protects your safety and that of your patients and colleagues.